Dear friends, I am Swamy Devarajan speaking, the president of New Generation Party. Um, just now I was seeing the News 7 channel. In that I came to, I viewed the channel with furthermore difficulty to see that the doctors are striking for the seventh day in Delhi against the government, government of India's permission to Indian medical practitioners, those who practice Indian type of medicine, including Ayurveda, Unani, Siddha, I think. I'm not exactly knowing which type of discipline they are asking. I hope it is homeopathy or Siddha like that. Those Indian medicines, homeopathy, Ayurvedic, Siddha, have been given permission to practice English medicine, medical procedure of surgery. They have been allowed, the doctors who have not studied surgery have been allowed to practice surgery too. This is highly condemnable. I strongly condemn the government of India, very especially the Human Resources Minister, Ramesh Pokhriyal. I think he would have given the permission. It's highly condemnable because different type of medicines or different type of medical practices are different only. We cannot club them together. But a doctor can give clubbed medical practice also, provided that he is aware of that particular study. And I hope English medicine is something different from all Indian medicines. Indian medicine are having some commonness in their nature. Siddha, Ayurveda, Unani. Unani is, I think, Urdu type or Islamic way of treating diseases. And acupuncture, that is also a kind of Islamic treatment, I think. There are so many methods to treat a disease. But English medicine is different. English medical practice is different. They study for more than 5 years. They study even 5.5 years, including the house surgeoncy and all. The education is so tough. Every page of a medical book has more than 100 words to be remembered by the doctors. According to me, up to my understanding, doctors are the people who study more than any other studies. Engineers and electronics engineers, instrumentation engineer, electronics and communication engineer, space technology, astronomical technology, whatever it is, all the disciplines, they study less number of books, less number of pages to remember. They apply less number of their knowledge, less amount of their knowledge, quantum of their knowledge base, or the intellectual coefficient, what they call IQ. Less IQ is enough to study any other studies than English medicine. English medicine is certainly the toughest one in the world. So that is the toughest one. Therefore, those doctors who have studied them only can practice them. All other discipline of medicines can be practiced by English doctors. English doctors can be allowed to do these type of mixed medical practicing because they have the knowledge of the human body in detail. They know the human body in detail. Whereas in other type of medicine, they study anatomy also, but the study they undergo the anatomy is for lesser period. The number of practicals they undergo is lesser than what an English doctor would have undergone. So that surgery should be conducted only by English doctors, those who have studied that. Any MBBS, basic degree, member of medicinal bachelor and bachelor of surgery, that is MBBS. So one who has the degree of bachelor of medicine and bachelor of surgery, only they should practice those surgical practices. English medicine cannot be practiced by any practitioners, any other discipline doctors. Whereas any other discipline of doctor practice can be handled by an English doctor very efficiently. That I know. I am sure about that. Because all other disciplines are related to English medicine. But English medicine is the master. It has everything. It is just like in the tea man, the tea, the long line. It knows everything. Whereas all other disciplines, they know a part of it. Okay. Therefore, I don't encourage the government's policy. As president of New Generation Party, I discourage the government policy to allow the all other type of medical practitioners to do surgery as an English doctor. Only English doctors are eligible to conduct surgery. Only they should be allowed to do that. But they can practice any other discipline of medicine. Because all other disciplines can be allowed. But nowadays, what happened? Even the pharmacists during the corona period, when they were, most of the doctors have closed their clinics fearing the corona infection, the pharmacists have picked momentum. Now the pharmacists who have studied D Pharm or B Pharm, they show themselves as the doctors. They themselves prescribe. They themselves give medicine. This should be banned by the government of India and Indian Medical Council and the regional medical councils, including Tamil Nadu Medical Council. The government of Tamil Nadu and the health ministry of government of Tamil Nadu and all other state health ministries and the government of India should ban the pharmacist to directly prescribe or directly give medicines. Without pharmacists should be barred from directly giving medicine without prescription of an English doctor. English medicine should be given by the pharmacist, even though they have studied B Pharm or M Pharm or D Pharm, B Pharm or M Pharm. They are not ineligible. They are ineligible to directly give medicine to the patients. Patients simply go and ask some, stating their problem. Immediately they diagnose something and they give some medicine. It will lead to the death of the patients also. Only the doctors know the cause, the remedy, and the medicine for the remedy. Therefore, government should ban the pharmacists also, those who have studied D Pharm, B Pharm, and M Pharm, to directly dispense with the medicine to the sick people. They should do that only. They should give the medicine to the buyers based on the prescription of the doctor. Without prescription, we should not give medicine. Directly, they should not sell medicine at all without the prescription. Their billing should be based on medical prescription of any English doctor only. So, English doctors are more qualified than anybody in the world. Any discipline of study is lesser than the studies of an English doctor at bachelor level. Even at master level also, proportionately they study more than any other master degree. In the PhD also do proportionately very rich work than any other discipline, including physics. This is chemistry. This I strongly ascertain, strongly say. And therefore I request the government of India, especially the Human Resources Ministry and the Health Ministry, to immediately accept the view of the doctors, protesting doctors in Delhi, and withdraw the GO permitting all other discipline of Indian medicine to do English medical practicing, especially in surgery. So I request the government of India to do the needful and make the doctors happy, especially the English doctors. Shiv Om. Today it is 7th of